Well, should we get started? We'll start on time and then we'll let people come on in and join online. Welcome everybody to the O'Brien Institute for Public Health Seminar Series. I'm Dr. Pam Roach. I'm the Deputy Director of the O'Brien Institute, here to welcome you today to Beyond Silos, How Transdisciplinary Health Research Works in Practice. And so this is really exciting as we see more and more of a focus on transdisciplinary research across the university. We have some wonderful people here to share how to do it with all of us. I'm going to start off our event today. Just as a reminder, there's some food at the back, so do help yourself to lunch. And I'm going to introduce our moderator for today's session, Dr. Katrina Milaney. Dr. Milaney is an Associate Vice President Research and Professor in Community Health Sciences here at the University of Calgary. She prioritizes community-led research focused on health equity and vulnerability related to disability, homelessness, gender, domestic violence, and mental health. Her primary interests revolve around political ideology and how decision makers impact policy, public systems, and service delivery. A very good colleague of mine. I'm just really happy to introduce her today. And also would like to note that she was the recipient of numerous awards, including the top 20 most compelling Calgarians. And so I will hand it over to you.
I must have been a slow year that year. Hi, everyone. Very happy to be here. My primary appointment is here in Community Health Sciences, if you don't know that about me. But I've been spending the last couple of years over on main campus as Associate Vice President Research. So it is always a pleasure to come back here and see some familiar faces and step away from research administration and get into some really interesting conversations about how we do good research and community-based research. So I'm absolutely thrilled to be here. So would like to start with a land acknowledgement. University of Calgary, located in the heart of Southern Alberta, both acknowledges and pays tribute to the traditional territories of the peoples of Treaty 7, which include the Blackfoot Confederacy, comprised of the Siksika, the Piikani, and the Kainai First Nations, the Tsuut'ina First Nation, and the Stoney Nakoda, including Chiniki, Bearspaw, and Goodstoney First Nations. The city of Calgary is also home to the Métis Nation of Alberta, Nose Hill Métis District 5, and the Elbow Métis District 6. A personal reflection for me, I was born and raised here in Calgary, and on days like today and this past week, where we have the weather that goes from like plus 15 to like minus 31, the wind chill. I know it like for a lot of people that feels really weird and unusual. And for me, I actually love that. I love that we live in a place where there's variation in the weather. We actually have 4 distinct seasons. We have the snow season, we have the growing season, we have the hot summer season, and then we have the beautiful season in the fall. And there's lots of places in the world where that doesn't happen. And I think I would not be living in a place like that. This really energizes me, and I am so thankful to our First Peoples and the stewards of this land that I get to live here, do many fun things with my family here, and yes, even work here. So I do reflect on that a lot and how thankful I am to be here. What a beautiful place to live. So it is my pleasure to introduce a very dynamic, interesting, and amazing panel. I have some bios for these amazing researchers, but we're here today to talk about how this group of 3 in their own ways and sometimes together actually do transdisciplinary research. They do it in ways that are outside of our typical disciplinary silos. Not that we don't need those disciplinary silos, we certainly do. But there is a major initiative happening here at UCalgary right now to really amplify and elevate impactful transdisciplinary research. It's important to this university because there are really complex problems that we cannot solve in singular disciplinary ways that really require multiple stakeholders and partners from outside of academia, that require different orientations and different theories and different research methodologies and different ideas that you can only get when you bring a group of people together who think differently and have been trained differently, for example. And so the Institutes for Transdisciplinary Scholarship is a flagship initiative of the University of Calgary and the Vice President Research Office in particular. It is something we are very, very proud of. And despite some of the tensions around it, some of the misconceptions or uncertainties around it, we are emerging as a national leader across Canada in this space. And so it is amazing that we have these three experts. I know people don't always like to be called an expert, but these are three researchers and supporters of transdisciplinary work who are really making a difference in the work that they're doing. So we have, and I actually know all three of these women and have worked with all of you in different ways and different capacities. So that almost never happens when I moderate a panel, that I actually have personal and professional relationships with the panelists, which I do today. So I'm absolutely thrilled for that part of today too. So thank you all for being here. Okay, they have very long bios, and I've been instructed to maybe just read the first couple of sentences so you get a sense of who these very accomplished people are. So please, if you at any point want to add anything to your bios or the work that you do, please do when you have the mic. So immediately to my right, we have Dr. Gina Dimitropoulos. Dr. Gina and I have worked together a bit in the youth mental health space. She is an absolute amazing national leader in this space, in community-based research, working with youth, with community organizations, working with youth, very prestigious grants, doing really important work, integrated youth services, Kickstart, which hopefully you'll hear a little bit more about as Gina gets into her presentation. And there, I didn't read anything from your guy. So Dr. Nynke van den Hoogen and I have known each other for a couple of years in different roles that Nynke has had at the university, including in your former life as a postdoc here at UCalgary. I was beyond thrilled when Nynke stepped up to join our Institutes for Transdisciplinary Scholarship as a senior specialist in health and life. She adds tremendous value to our work and works with some of our academic co-leads and with our director, Dr. Carolyn Emery, to really elevate, like I said, and amplify transdisciplinary research in the space of health and life. So welcome. I think the last time I was moderating a panel here, you were also a panelist. So you were really out there doing good stuff. It's nice to see you. And Dr. Jenny Godley. Jenny and I also go way back to a former life that you had in terms of the Research Ethics Board on main campus. But Jenny is one of our academic co-leads in the Institutes for Transdisciplinary Scholarship, has appointments in anthropology, archaeology, community health sciences. Does social network analysis, again, does good community-based work. So again, from different disciplines, social work, neurosciences, and the arts plus community health sciences. And so, but somehow we all managed to get along and we do great work together. So I'm really excited to jump right in. We've got a few questions here that I'll ask our panelists, but we will make sure that we leave time for all of you. This is a fantastic opportunity for you to pick brains around what does this actually mean in the real world, not just, you know, on a website or some rhetoric that you hear from main campus or whatever. You get to hear some real world examples of how we do this work. So let's jump right in. Anything from the three of you that you want to add to anything about your work? You can really jump in. Okay. And please, just whoever wants to jump in at whatever time of whatever question. Okay. So this is a really important question, I think. So being that you've done disciplinary work and you've done transdisciplinary work, what has taking a transdisciplinary approach made possible that you couldn't have done without taking a transdisciplinary approach? Anybody who wants to start?
Okay, I'll start. And if you can't hear me at the back, please let me know because I tend to talk really softly. And I just want to just say what a privilege it is to be here, to be among these esteemed people, to be speaking about my work and how I work in a transdisciplinary way. I just want to start off by saying that I think that, and I've taken a look some notes because I felt this is really important to talk about because I have such good partnerships with people with lived experiences, with researchers from various backgrounds, with industry, with various community-based organizations, with government. And I really want to just say that I think I'm a better researcher and better person. As a result of all of these partnerships that I've created over time, I feel that it has strengthened the research that I do, that I have learned so much about different methodologies, ways of doing research, maybe looking at a problem, because I would only look at it through my own lens and then realize not only, do we look at something through various lenses like theoretical or methodological, but then when you work in the community and work in different sectors, each sector has its own language, its own way of kind of also addressing a problem. And it's like learning a lot of different languages and different ways of approaching things. So I think it helps us to tackle issues in a more effective way, because they're often multi-determined or need a multi-pronged approach to how we address them. So I think that that's helped me to just learn so much. So I'll leave it at that. Thanks, Gina.
Sure. Okay. Yeah. First of all, so thank you so much for having me here. It's great to be at Foothills after being here for a very long time as a postdoc, to be back now that I'm on main campus. And I think I'll answer the question with a little bit of background about like my career and why I had the transitions that I've had in my career so far. So I am a preclinical neuroscientist by training, which means I've done a lot of animal research, a lot of cell research into early life pain and opioid withdrawal. So I have a lot of mechanistic knowledge, but throughout my career, I kept noticing, okay, I'm doing all this research, I'm publishing papers, I'm making the progression I'm supposed to make, but I'm not seeing the effect that I have on children or babies that are undergoing pain or on opioid withdrawal. And obviously this pipeline is a very long pipeline. It takes years and years and years to get there. But there's also a different side to it where other voices aren't heard. When I talk to clinicians, I could hear questions that they ask me, where I think we have those answers, but they're not available to you. They're not readily available to you, or not, like Gina said, in a different language, almost in a different terminology that we use in a different, even within the same field in the different disciplines, preclinical or clinical. And then throughout my career, I really wanted to see that effect that work has, that impact that we can have with our research, and with, even if it's the disciplinary work, you're still part of a bigger picture. And I noticed that when I did my second postdoc here, I switched to clinical research. I did patient engagement and knowledge mobilization, which is very different from rat and mice models. So I learned a lot how to talk to people instead of to my mice. But just getting that knowledge really showed me that there's so much sides to each problem that you'd never think about. And I think that's part transdisciplinary brings to me, is you actually see the entire picture, and therefore can also actually attack a problem or a health issue, in this case, with all the different tools available and all the different disciplines available to you.
I think for me, part of it is I was trained both as an anthropologist and a sociologist, which in some places are very similar and in some places are very different. In my case, they were very different because one was very qualitative and one was very quantitative. So I always had that transdisciplinary outlook. And I think also as a sociologist and someone who cares about social justice, I always wanted to bring both a theoretical and a methodological piece to other research. And once I started working with many of people here, especially clinicians, I think what was really exciting to me was to be able to say to them, they would say things like, well, I know my patients, this is the problem, right? I know my patients don't have social support, or I know that, in the community, homelessness or being unhoused is tied to so many other things. And I would say, oh, well, we can study that. Like, we know how to study that, right? Over there on main campus. And it was always very exciting when people said, oh, really? Like, wow, they just didn't realize that there were all these disciplines out there that look at how people communicate with each other, relationships, culture, context. And I think many people working in the health field know how important those things are, but they don't necessarily have the background or the skills to examine those features of the world. And luckily we do. And so I've been really lucky to work with a lot of people who have the skills that I don't have, which would be the skills in terms of testing and treating patients for hepatitis C, for example. But I can bring something to that work, which is the social determinants of health lens and how theoretically to think about it, but also methodologically how to study it.
So you're smarter, you're all smarter, you have better conversations and you have relationships that you wouldn't have had otherwise.
We have more
For a good
friends.
summary, you have more friends. Thank you. So let's talk about community partners a little bit. So when you're working with community partners, what are the important steps to make sure research is actually co-designed to meet community priorities? This is a big one.
Start early.
Yeah.
I think a lot of times we design research and we design questions based on things we know and then bring it to community and ask them what they think about what we've come up with. I think to meaningfully co-design, you have to do that before. And that's something I've learned along the way. Asking patients, what are you actually struggling with? And this is especially interesting if you look at patients with pain, which was my expertise. A lot of them didn't necessarily care about the pain. They cared about not being able to sleep. They cared about not being able to lift their groceries or play with their grandchildren. Those are the things they actually cared about much more than whether the pain was an 8 or a 5 on the pain scale. So really talking to them changes how you see a problem and changes how you start developing research around that. I'll leave it at that because my colleagues have a lot more experience with.
Yeah,
partnerships.
maybe I'll just add from my experience on the ethics board. I agree. I think building those relationships way before you ever come up with a research question is what's important. And there's been sort of a misconception, I think, certainly on main campus about when you can start talking to people. So we've really, during my time on the ethics board, we really tried to change that perception to make people realize that you do not need ethics before you talk to people. In fact, you probably shouldn't get ethics unless you've already talked to people, and really building those relationships first and making sure that whatever community you're working with, that you're speaking with a wide range of people within that community. So you're not assuming that any one body or one person speaks for that community, but that you're really getting a wide range of diverse opinions from the community and respecting the fact if they say, actually, we really don't care about this problem. We don't want you to study this. It's not of interest to us, right? Really respecting that. And I think sometimes we get driven by our funding and, we think, well, we have to do a project on HIV because that's what the funding is for, right? And that may not be the primary issue that this particular community is dealing with at the time. And just being really humble about what you don't know. I'll never forget when I was working on the hepatitis C project with Mark Swain and his colleagues. I'll just tell a quick story if that's okay. I had developed a survey and I was interviewing clients who were coming to our hepatitis C clinic, and a lot of the clients were unhoused. And I had a question in there, which I thought was such a great question, which was, what makes it difficult for you to access healthcare? And I sat across from people and said, what makes it difficult for you to access healthcare? And every single person looked at me and was like, I do not have a home. I'm unhoused. Like, you're an idiot, right? Basically is what they were saying. And they were right. Like, it was a dumb question. But that was a good moment for me, I think, to realize that, sitting in my ivory tower, I was thinking, oh, I can just get them to answer this question. It will be so interesting. And I wasn't understanding where they were coming from at all. In fact, it was insulting that I was asking that question.
That's a great example.
Yeah.
Gina, you've got lots of community.
Yeah, I have a couple of different examples, because maybe that'll help make it real
To life.
I do think it depends on what you're hoping to co-design with partners, because there's obviously different purposes. It could be co-designing a partnership, or it could be co-designing research questions for a grant. And I think, as Jenny said, we both talked about this, that it's sometimes we have to be really transparent about what we can and what we can't co-design, and I think being honest about that, because sometimes there's a call for a grant. And there's some things that are, are non-negotiable that we have to address because of within the objectives of the grant. But then letting people know what is really within scope and what we could do together. Because I think that the lack of transparency and not talking about that upfront can create a lot of mistrust and confusion, and it's just not a very good way to work with people. And I think I've learned that over time. Be like upfront about what's feasible, not possible. I've done a lot of work with hall services and a couple of other organizations I haven't talked about, but I use hall services, and I was in a meeting with them today, and I said, I'm so excited because I get to talk about some of the work we've been doing together. But we've been working together over the last 5 years. Hall services is a community-based organization that serve a lot of young people from birth to adulthood who have experienced child maltreatment, and they often provide support to people who are in care. And we've been working together to co-create like the vision for how we want to work together, what our 3 areas of pillars are that really shape the work that we're doing together. And it's taken years. And it's constant back and forth and making sure that we're all aligned, so the priority setting piece here and how to co-design that, to me, feels like that's easier to do. It's the bigger piece around the relationships and the vision and how we're going to work together to make sure that there's trust and there's an ability to also sit with conflict and tensions. And so more attention to process than outcomes, I think, is what's important around co-creating priorities.
Yeah, the time and the energy and the trust building is huge. Making sure there's reciprocity. Community organizations that work with us are going to get something out of this partnership. It's not just one-sided when we get our publications. Sorry, no, go
I
ahead.
think that's also true working across disciplines, and particularly working, for me anyway, working with clinical faculty. One of the things that I had to learn was that for me, like, this is reading break. This is a big deal, right?
Yeah.
But for clinical faculty, they're not teaching, they don't notice, right? But on the other hand, when they're on call, I can't contact them, right?
Yeah.
And just the little things about our schedules, we don't have the same job. And so knowing how the different pressures that different people are under, depending on where they are in the university, I think is really important, and respecting that.
Just being open to that kind
Yeah,
of.
yeah.
Can I add to that too?
Yeah, of course. That's what this is all about.
I'm like excited about what you said because I think it's so important. I'm just thinking about some other work I do with like folks in Alberta Health Services.
Yes.
Alberta, and a lot of excitement around co-designing what measures to use to help determine what level of care young people need for mental health services. And I was like, we're going to co-design it from the beginning, and there are clinicians who don't have a lot of time and the freedom to be able to like spend hours co-designing. So their feedback was like, no, you're going to do most of the work. You're going to come and be prepared to share with us what it is that you want us to co-design. So again, that goes back to like being really clear about like, what bandwidth do people have? What's their capacity? And to be really clear like what we mean by co-design. So I was just thinking that clinicians and people from different disciplines don't always have the same bandwidth or the opportunity to do the things that we think that they can.
And yet we all have a role to play in the bigger picture research project, right? So our role as researchers, get the funding, get the ethics in place, hire the staff, follow the research procedures, but the people that we work with are actually the experts in what we're trying to understand. Yeah. Speaking of grants, you said something about grants. This is a segue into writing grants, good transdisciplinary grants, and how you write a good transdisciplinary grant, and what you build into those grants, particularly around timelines and budgets. Because a lot of times when I work with people, they're like, we got our grant, but we don't have the money for that big knowledge mobilization piece. We don't have the money for that big upfront piece of work, building relationships and co-creating. So what are your thoughts on how you actually tackle those kinds of issues?
I think you have to build that in right from the beginning, but I think it's really hard.
In your grant.
In your grant,
Yeah.
yeah. And just as an example, this isn't a grant example, but with a different hat on, I run the new transdisciplinary PhD and master's program. And we put into the students have to have a community member on their committees. And the community member isn't a voting member, but they're supposed to come to the meetings, they're supposed to read things, et cetera. So I put in a budget for that. And I said, we have to pay these people, we can't just ask community members, whoever they are, whether they're from industry or a community specifically, we can't just expect them to show up for a PhD defense and not compensate them for that, right? So we put that right into the budget early on. And I think it's the same with grants. You need to think through all of that early on. But you guys have more experience than me.
I will say one thing, and this is what I, of course, appreciate about the University of Calgary and the Institute for Transdisciplinary Scholarship. There is seed funding from ITS. So they're called the Connector Grants, and these are designed to be either that initiating step of making the first connection, trying to start building that team, or a consolidating stream where there's more partners needed or a deepened relationship built. So those are here, I'm very lucky to have that. To able to build that into grants and be able to write that in a way where you then have the opportunity to apply for bigger grants with part of that work paid for. I will echo what Jenny said, compensate community partners in a way that's meaningful to them. So talk to them about what kind of outcomes they would like to see. Compensation monetarily is, of course, a great option, but sometimes community partners are the company or in industry, and they might want something else out of the project. So really making sure that everyone's voice is heard. And if I talk about the connector grants, for example, they're team grants, so everyone is a team member. That also means that we're hoping that everyone has at least read through the grant, commented on the grant, co-wrote the grant preferably, and really you can see in every section that everyone has been involved in some way. So I think that's, it's tricky to build this into bigger grants immediately, because there's a lot of rework and a lot of consultation you want to do to build bigger grants. But that's what the connector grants are for. In terms of timeline, things are slower when you work in a team, or at least they can be. Sometimes it's more efficient to do everything by yourself, but as I hope you all have heard by now, transdisciplinary really focuses on doing it together with a team to have more impact. That might mean that it's a slower process. You might have to step back and discuss terminology in a meeting and say, okay, I'm using this word. Does that mean the same for you? So there's a lot of those steps that have to be involved with, if you're writing grant, that have to be built into the budget and the timeline.
And for the connector grants, isn't it like a 45% success rate? 52% success. So for those of you who are used to 12, 13, 14% success, take a look at the connector grants.
And feel free to contact me and I'll happily talk you through the process. We have 3 deadlines a year, so.
They've been a game changer for, so the work that I've been doing in collaboration with community partners, and we then can start from the beginning and co-writing the grants, and have allowed us to be able to bring people from across the province or the country together. And in terms of funding, I think it's always absolutely critical to compensate young people who may be partners, research partners, or compensating for their time to provide consultation. So I think that's like something that I often think about, like, because you're not always allowed with CHR grants or other tri-council grants to give money to communities, but you're thinking creatively about, like, how will I compensate those people for the time, and then how to do that in a way that doesn't create inequities. Because that's really being like thoughtful about it, or having conversations that are again transparent. Because they may misunderstand how the fund would be used, but beyond like monetary things, I think
being really clear, and I think Katrina, you talked about this, that we're not wanting to be extractive. Like, I think it's about making sure that whatever we're doing, that it's about sharing results or data, or creating knowledge, translation of it's going to be meaningful to the community. So I think about it in a lot of different ways when I'm writing grants. Like, what are we building in here that's going to be really meaningful? And feed that back to the community, so it's not just extractive. And then the last thing I'll say is really supporting early career researchers and graduate students. That to me is like making sure that our funding is really also helping others who are really starting out and who really benefit from having some funding to help them as well. For training or career.
Yeah, thank you. Thank you for that. So there may be people in the room who are just stepping into this kind of work, into transdisciplinary research. So what are some tangible or practical ideas or steps that people can start to take if they're interested in actually doing this kinds of work? I mean, the practical one we just talked about was the connector grant. That's actually money. But what are some other ideas for people who are just stepping into this work?
I think really just reaching out. There's some part of the joy of having been the ethics chair is that I saw everything except medicine, basically. I didn't see any of your applications, but I would say to Gina, oh my gosh, there's someone else working on eating disorders over here in education, and then they would have a chat maybe, right? Yeah, and so just really reaching out across campus and not just our campus, but if you have a burning interest in a substantive area, there's probably someone studying it from another perspective, from another discipline. And people are always happy to talk about their work and their research. And just making those connections, have a coffee with someone. I think that, and then in terms of community organizations, getting to know the community organizations, volunteering with a community organization or just showing up and offering something, I think is really important. Those face-to-face meetings, I think we've all realized since COVID, that those really make a difference. I mean, we've made connections through students often, right? So graduate students might ask someone to be on a committee for your graduate student, and then you realize, oh, they have an interest in this area. Maybe we could put in a grant together. I think often students connect professors. Yeah.
And in that sense, ITS and the different colleagues in different areas of focus all organize different events that are really meant. They always have a large networking portion meant to be that collision space where you can talk to other people. I'm always happy to talk to people if you want to know more about how to approach it. One of the things we have on our website also is the successful connector grant teams and the topics. So if you want to just learn more about, oh, this is a similar topic to what I'm thinking, I would like to know how they tackled that. You can reach out to them or have me reach out to them for you. Yeah, just talk to people is the most important part, I think, and visit events. And if you have idea of how, what types of events would work better for foothills, because I'm aware that the trek to main campus sometimes is a bit far, especially when it's -25 outside. So let us know. We're open to ideas. We're open to making sure that everyone has access to this. But even this is something we need to approach in a transdisciplinary way. Everyone needs to give input to make things happen.
So Nynke, one of the things that I've noticed is that there is an actual gap, not just a geographic physical gap between main campus and Foothills campus. People don't know necessarily what's happening on main campus in some of these. So you have a website, but can they sign up for the newsletter?
Yes, we have a newsletter. That's actually what's on the screen here. So this is our bulletin, our newsletter, about once a month. We don't send a bulletin on a standard day because we want to make sure we have enough interesting news, but it usually is once a month. And then we also have a Teams hub where people can just connect and talk amongst each other as well. Yeah, and our website is under development. We are working hard on more storytelling. And there's talk about all different types of making a menu of knowledge mobilization options for people, so that we can provide more information to other people, both on and off campus, of what transdisciplinary work looks like.
So do sign up for that newsletter.
Oh, yes, we also have a transdisciplinary path makers speaker series. It's geared towards early career, but everyone's obviously welcome. And these are people that are transdisciplinary researchers, and they talk about their journey from wherever they came from to where they are now, what their research, how they approach things. So kind of like this panel in a seminar series. So we have one every month. And we alternate online and in person doesn't include lunch, so.
And we alternate here in main campus, right, in
Yes.
person.
Yeah.
Yeah,
So once every 4 months, there's one here.
Thank you. Anything to add, Gina, on how we should get started?
I agree with everything that's been said. I've been thinking a little bit about how we're all really different and how we approach connecting with people is different. So really take the time to think about what's your comfort zone, like you're going to an event and socializing, something that's comfortable. I'll be honest, that's not like easy for me. I'm an introvert. I like, that isn't always easy. I know a lot of, the students that I work with are like, I don't really want to do and like go this like open social event. So I keep thinking about like, how can we do things differently, like in that really feel comfortable. So maybe emailing someone and just sharing a little bit about yourself and inviting them to share back, through an email, setting up a virtual meeting, asking them for a tea. So I feel like figure out what works for you, because you gotta be comfortable with how you want to engage with people. And I think it never hurts to ask somebody, can you connect me with this person?
Yeah.
Because those cold calls sometimes can be really hard. And no matter where you are in your career, I think cold calling somebody and saying, hey, this is who I am, it feels really vulnerable. So I just want to maybe put that piece out as well and just say, you, like Jenny's always introduced me to people. It's like, I love it. That's what we want, is we want our colleagues and our friends to be able to say, hey, I've got someone who would really like to meet with you to hear more about your research. And those, I think, are the best ways to help each other out and facilitate those connections, because it makes it easier for all of us when someone does that rather than those cold calls.
Well, I mean, that's an important piece around why diverse perspectives is important too, right? It's not just your area of expertise or the way you do research, your methods, your partnerships. It's also the way you show up in this work. And so if I'm an introvert too, believe it or not, even though give me a microphone and I'll talk all day. But, if I'm an introvert working with people who are more sort of out there and engaged and, it is another skill set that we bring them together. It just enhances the richness of the work that we do.
and that's all about being authentic, I think.
Yeah.
Just really being who you are.
Yeah. Okay, so I have another question here, but I actually want to edit it just a little bit, if that's okay with you. We've talked a lot about how hard this is and how much time it takes and how much it costs. So can we talk a little bit about like, what does meaningful partnership look like? What are the actual benefits and outcomes? Like, why do you even do this? Like, why is it important to do this kind of work? People are here, obviously, maybe they're here for the pizza, but maybe they're here because they have an interest in doing research a little bit differently or having meaning in their research. So can we just talk a little bit about what that looks like and so what? Like, why should we even be doing this?
I think for me, I've always, partly because my mom was a social worker, I think, I've always felt that the research side of things was a bit too removed and what was I doing, writing papers and who was ever reading them? And so once I started doing more community engaged work, what was exciting for me, as well as sort of the clients and the folks who were working with, was a lot of the community partners, enabling them to work together, work with each other. So for the hepatitis C project, we were able to bring a lot of community partners together. And they would say things like, oh my gosh, I've been referring someone to that agency for 5 years and I've never met you, and so seeing through the research, we were able to bring together people who actually are working with the same clients, but hadn't had a chance, hadn't had a time.
Or a reason, maybe.
Yeah. And so that was really, really exciting for me, was I felt like we helped boost up the ecosystem a little bit by making those connections for people. And the work that we're doing in Northern BC We're working on spirometry access for people with COPD. And I think what's been most rewarding.
Barometry.
Spirometry is a test. Somebody here probably knows way better than me, but it's a breath test.
Okay.
And it's the only official way to diagnose COPD.
Gotcha.
But many people get diagnosed with COPD without the spirometry test. And it's equipment heavy. So in the rural areas, people have to go somewhere to get this test. But what's been exciting there is that the respiratory therapists who do a lot of the work, they always thought that, for example, COPD was underdiagnosed, that we didn't have enough spirometry machines, and we've been able to give them the data to show that. And I think they've been very grateful for that because they can kind of say, this is what we knew in our hearts was happening. But now we have data to show that we need more machines and we need more access. And so I find that really exciting because I feel like that's actually hopefully changing somebody's life. Maybe I'm being a bit too hopeful, but
It's a great example.
more than just writing a paper that by people.
Yeah, I fully agree with that. While you were talking, I was just reflecting on my own journey and kind of feeling the same of like, I just hope that this way it will have an impact and I can see the impact and those things, you know, in your heart, like doing my CENRAD research, I know in my heart and very obviously as well that they're not humans. So is it translatable to humans what I'm doing? Not every human is the same. There's so many differences that can create different aspects to the disease looked at from a biological perspective. Seeing the whole picture and hoping that that will have more of an impact. And just on a personal note, I was a postdoc for 7 years. I definitely thought I wanted to be a professor, but the second I stepped into this role, I have been early for work every day. I'm super happy to go, and it's because I get to connect with so many different people in so many different ways, and I'm an extrovert. Express.
No.
So I like connecting with people and I like hearing people's stories. But just seeing how the meaningful connections you can make, how that creates impact, not just on the people themselves, but on their research, on the societies they're studying, on societal complex issues. And seeing the university going in that direction of really being able to tackle societal issues is very inspiring. So, yeah, thanks. It's great.
And that was beautifully done, because I feel like what is different and what is so incredible and rewarding is that when you do work in a transdisciplinary way or interdisciplinary way or both, that you do feel like you're doing something that might help address like working problems or help address systemic structural issues. So I think, actually, at least it makes, I feel like the work that I'm doing, I really hope that it's impactful and more practical and really relevant to the people who are on the front line or people who are living, who are actually affected by some of the issues that are important. Because I think that there's nothing worse in this world than like doing work that is just needed. It's like that's, so I think it's just been really, really rewarding and really, really meaningful, I think, to work alongside the lived experiences and other friends.
Those are great
Sure.
examples. Yeah.
I like question.
Oh, is it time for that?
Start, sure.
Yeah, let's do it. Let's have an online question. People are tired of hearing from me, so.
Catherine Hoppers asks, this session casts transdisciplinarity as a relief from the old ways, etc. But how about the disciplines we have left behind and what happens then?
I don't think we've left them behind at all. I
don't
think they
think we
get
should.
stronger.
Yeah.
Yeah, I think your own discipline can only get stronger from having interaction with other disciplines. And I think that some of them maybe we do want to leave behind, but I'm just joking. But I think that I think that it's absolutely not true that transdisciplinary does not mean that the disciplines are still important and that good, strong disciplinary work is still important. Yeah.
Yeah, I was gonna say, have to be strong within your own discipline to be able to work. across disciplines.
Yeah.
You have to know who you are,
Yes.
like your professional values, competencies, frameworks, like, so I feel like it's actually made me more comfortable in my my role as a social worker or anything. So I hope I understood the question correctly. Is that doesn't?
Yeah. Thank you. I'm also like, tell me more. I want to know where that
Yeah.
question's coming from. So
You should have a
yeah.
coffee with Katrina
Yeah.
Hopper if you haven't met her. She's amazing, amazing.
Thank you for that question.
Transdisciplinary is really built on that disciplinary excellence. We need the disciplinary excellence. I don't think we should get rid of any of the disciplines because you need that expertise to really have impact together.
It's a great question. Is there other questions online? Oh, we have a hand up. Go ahead, Krista.
Thank you so much to the panel and Katrina for moderating. Just want to follow up on something that Gina mentioned, and maybe you could give us some practical strategies. So how do we co-write grants with community groups? And I'll speak just from a bit of experience. We worked with David and the group from Paul and others, writing a grant application in the fall. And I'm wondering how you balance that, what you spoke to, of like, come to us with something already developed versus writing it together. So how can you maybe speak to Gina, how do you approach co-writing grants with community groups and people with lived experience?
Yeah, I could give like a couple of different examples. Like I was thinking of like the work I do with Luna Index, which is our youth advocacy centers, and we've written a couple of grants together. And one that we did recently for EHAC, and like there's lots of discussions that happen beforehand. What do we mean by co-writing? Will there be one writer? Will there be multiple writers? Are we going to be writing different sections? But who's going to make the decision about what gets left in or what gets left out? Because sometimes there's, especially when you're working with community partners, they might feel like you have all the power. And so it's like as a researcher sharing, but really making sure that I'm not like viewing myself as the one who's going to, like it really is about sharing the knowledge and making sure that there's agreement about what it looks like before it goes in. So that's one way we've written grants, and who like might decide, I'm gonna lead the writing this one, you lead writing that one, but you're gonna review it and you're gonna change, but there's lots of discussions beforehand about what the methods will be, what the framework. So that's one example. Want another one?
No, that's great.
Okay.
Thanks, Gina.
One of the things that I've done too is I just ask people how involved they want to be and if there's parts that they want to write or if they want to just review drafts. And the other thing that I say all the time, especially when I'm working with other academics and other disciplines from mine, like I am a very theory-driven person. I'm very principled and very social justice driven. But when I write a grant, I write it for the reviewers. I don't write it to suit my own beliefs and values about the world. I write it so that I know and then this is what I say to my partners. It's like, we got to get the money.
Yes.
So we got to write this grant so that a reviewer will read it, be like, wow, this is compelling. This is a strong team. Look at how great they work together. And then when we get the money, we do what we want. Not, to be deceptive or to not do what we said we were going to do, but there will be nuances that we do. That might not be in the grant, but we're sort of on the same page around, we got to get this money. And so we got to write this for the people who are going to decide if we get the money or not. You know what I
That
mean?
creates tensions.
Yes,
Yeah.
it does. Yeah.
It'd be really hard to work. But
Yeah.
that's like that. Cause
Yeah.
I was gonna say that that's part of like sometimes something's really hard. It's like, well, that's not how you think it should be written. So yeah. And then, yeah, so having to work through that and model through that isn't always easy, but really important. But also like, yeah, I hear you that, like this is fun. Yeah.
Other questions in the room or online? Nothing online? Yeah.
Thank you so much. That was great. And we're talking a lot about the policy of that at the same time. And research. I was curious about the flip side. Have you been in the past with a parent project where you thought that, this is not the right way to go, or would never be?
When things don't go well.
I have one example. Trying to think about
How to say
how
it.
to say it in a way that doesn't disclose everything. I have an example of a grant we didn't get. That was transdisciplinary, a big grant. And the reason we didn't get it is that it involved Indigenous work and we did not involve an Indigenous scholar early enough. And I thought I was pretty clear about that, but other people didn't think so, and they thought it was okay to kind of add somebody at the end. And it was immediately clear in the grant review process, it was obvious that we had not engaged with the community properly. So that's one that went really, I would say, badly wrong for very good reasons. We should not have gotten that money. But it, you know, it was hard because early on I was saying, well, wait a minute, if this is what we're doing, we really need an Indigenous scholar and we need to connect with the community, and people weren't listening to that. So, yeah, that was tough.
Other thoughts?
I can say from my experience with the connector grants, like, the word discipline sometimes means different things, and especially here at Foothills, like, we think of medical disciplines as well. So sometimes we see projects that come forward that are for different medical disciplines working together, which is also very important, but it might not be transdisciplinary as for the university's reviewer panel. So like, those are some projects where I think, well, this is a great project, but perhaps not transdisciplinary as of this specific definition of it. Yeah, I would say that sometimes happens, but there are other grants for that, so. I believe we can always do, and have you thought about this or that? So, yeah, even if that happens. One thing that I really like we do in the connected grant process is feedback sessions after. So if you are unsuccessful, you're part of the 40%, 40-something percent that's unsuccessful. We do offer feedback discussions where we go through the feedback that has been provided by the reviewers to really let you know, okay, these are the things that they noticed. Sometimes it's a easy fix and then you get it on a resubmission, or sometimes it just means, how about we help you look for a different avenue?
I would still do that. Any thoughts, Gina? That was such a great question, and I'm like sitting here thinking of everything that, you know, hasn't always gone well, and it's usually because me. So I think
Because of you?
yeah, like I think, you know, like, I mean, when I think about, well, I don't mean that in a, like, I think sometimes things don't go well, not because of the others. You know, like maybe the way we might have approached something or described something and it wasn't in a way that was understandable to others, or like you were using your own jargon, or like kind of approaching something from like your own discipline that didn't resonate, or so I feel like, you know, like I think that what hasn't gone well has actually been good for me, like, because it's pushed me to kind of think about how I work with people, how I need to slow down the process sometimes and be intentional and not, you know, rush things. And so I just want to say that sometimes I think it's whatever hasn't gone right. I think things are always really complicated, but it's forced me to stop and say, what can I learn from this? And differently. So I'm much more, I think, open to like just not rushing through things as much as I have in the past, because I think that's where we always move on.
I'll just maybe add an example, since I'm not a panelist, but I do a lot of this, take freedom in the fact that I'm moderating. One of the biggest issues that I've had in getting successful transdisciplinary scholarship funded is actually the reviewers, and helping them understand what it actually is and what the value and the benefit is. Because a lot of reviewers will come from their disciplinary backgrounds, and they might not, if we don't do a good job of saying, this is the only way to answer this question, because we have failed to address this in our disciplinary silos. If you're not super clear about that, a reviewer would actually read our grants and be like, I just don't get it. Like, I don't get it. What's the big deal? So that's been my experience in failed funding applications, is like the comments that I get from reviewers, it's like they clearly don't understand what I'm trying to do here, which again is my fault. Because I assume that people think the way that I think, and they don't necessarily. Yeah, like
I have an online question.
Okay.
Shiny Chowdhury asks, speaking of grants, is there space for student-led projects? Currently, there are early career research grants, but for example, encouraging a student to use their thesis research to create a direct community impact.
In a grant
like grants for students that's based on their work? Anybody know of opportunities for students to get grants?
Students aren't eligible to be project holders, but that's an administrative rule. However, in the connector grants, they are full team members, so everyone is a leader, but also a team member, so everyone can lead the project from there. So we really don't like the language in our team of investigator, collaborator, those kind of principal investigator. We use it, but when we talk about connector grants, we talk about team members and project holders. The project holder, in that sense, is a faculty member, but for the administrative purposes of holding the funds. What the team decides who leads the project, it's up to the team.
Can you tell me, there's some awards I'm seeing through like a work goal, one child, every child,
They're undergrads, there are pure awards. Yeah. For undergrad students, there's research awards for the summer.
and Shirkas now, I've noticed that like postdocs can apply it.
Insight development grants, yeah, postdocs and those.
Yeah, and postdocs can hold like this, a lot of special competitions with CHR, as well, like the smaller ones.
Yeah, the planning dissemination one, for example, yeah.
We got a thumbs up. How are we doing for time? We have 4 minutes left. Is there another question online? No. Other questions in the room? Go ahead.
Just some thoughts, how do we nurture the connections when the money doesn't come through? Like, how do you sustain that when the galvanizing work that you were going to do, can't move forward?
It's a good question.
I think you have to sustain those relationships. You have to keep in touch. Yeah, because that's awful, right? For if you're working really hard with an organization and then you don't get the money and then you disappear,
Yeah.
right? I think you still need to be on their doorstep, helping out, connecting over other things, wondering if you could submit it somewhere else, those kinds of things. Yeah, because otherwise I think that's so insulting.
I agree, like, I feel like some of the relationships that I'm thinking about, like Chicks Down, which is the Integrated Youth Services in Alberta, we worked together for years, whether we were getting,
Yeah.
it's like, just, I felt like we were doing a lot of work off the side of our desk, so I know when you are successful, it's great, but I've also been in situations where we're just grant after grant, we're not getting it, and it's so demoralizing, but you just keep at it, you keep working, figure out what is it that we're doing, that we could be doing differently, and or maybe we're not gonna change what we're doing, we're just gonna keep moving forward and apply other grants, so it takes a lot of perseverance and just kind of like, yeah, just keep moving forward, and said Jenny, just like you don't stop just because it's right. Your relationships with community partners is bigger than ever. And it always, to me, feels like approaching it in that way, like you're in it for the long haul and not because of a special call. At least most of the time, that's how I want to work.
And sometimes there are other things, like, I just remember one, I was working with an organization, we didn't get the grant, but then one of my students went and worked for that organization. So you can maintain relationships in other ways, perhaps, right?
Yeah. Demonstrated commitment.
Yeah.
Yeah.
Yeah,
Yeah, and I would echo what Gina said before as well. Be honest, like
yeah.
the frequency of communication might go down after an unsuccessful award because there's not as much to communicate about, but an email here and there is also a way of keeping in touch, like being upfront and honest about that even before starting to write the grant. That definitely helps keeping those relationships intact in the long run as well.
Okay, wow. Well, that was a fantastic lunchtime discussion. Thank you, all
Thank you.
three of you, for sharing your insights and your wisdom in this work and for your commitment to transdisciplinary scholarship here at UCalgary. It really is really important work, and you are all champions and exemplary workers and scholars in this space. So thank you for sharing your expertise and your insight. Thanks to all of you for being here and for your great questions. Please check out the ITS Institutes for Transdisciplinary Scholarship. I know it's kind of a weird name. It's like, what kind of institute is that? It's institutes. Sign up for the newsletter, check out the connector grants. These are Yeah. Reach
Have
out,
coffee with me.
yeah, reach out at any time if you have questions after the fact that you didn't get to ask in this session. So I hope you all have a great rest of your day and enjoy the blue sky and the sunshine, even though it's freezing outside. Thanks, everybody.